loops to establish left-right polarity begins in 4 weeks of development. As we already said that 4 chambers start to develop in 4th week of development. This is easy to remember. So how does it go from left to right and from right to left? It means that there should be some cells, and cells should move like left to right, left from right to left, and left to right. There is an element in the cell which is called dynein. Dynein is an element of the cell. This is a very important element of the cell. Cells, imagine if we consider this a cell has a cell membrane, and inside the cell there is cytoplasm, mitochondria for energy, Golgi bodies for storage, and everything else. It has a nucleus. At the same time, the cell has dynein. What is the function of dynein in the cell? Dynein helps the cell to move around. It helps with the movement. So dynein is the movement element of the cell. It's very important for movement of the cell. So this is the dynein that helps the heart to be polarized, to move around, because heart itself cannot move. The cells of the heart has a dynein, and dynein is helping heart to be polarized. Where else we see dynein? Where else we see dynein? And cells that are moving. Which cells in our body are moving? We have cells in which part of our respiratory system that are moving? Like we know that inside the nose we have here, right? Which is called cilius. Wherever we see cilius, not only inside the upper respiratory tract, but wherever we see cilius, it means that those cilius are helping with the movement of the cell. So the why I'm explaining dynein and upper respiratory tract, just to understand kartagener syndrome. So let's see where we find dynein. We find dynein in all the cells that are moving. Which cells are moving? Cilius are moving. Where do we see cilius? We see here inside the nose. This is a cilia, right? Those cilius are moving because they have dynein. Where else we have cilia? We have cilius inside the tube or salpinx and female reproductive organ. The cilius is moving the sperm downward to the uterus, right? To the out of the uterus and toward the ampulla to meet the ovum, right? This is the cilia in the tube. So the cilia in the nose. So these are all having dynein. So now what else in male? We have a sperm, right? A sperm is also moving. So the flagell in a sperm is moving, helps with the movement of the sperm. So what does flagell have? Flagell has this dynein. This is the cell element which helps the cell to move. Now that we know that this dynein is everywhere, it helps in embryonic period, it helps the
Excuse me,
heart.
Mahjuba, I am interrupting you. So what is dynein? It makes cilia, or is it a
It is a part of cilia. It's a part of cilia, right? It is not making cilia. Cilia is a cell, right? Cilia are cells, and inside these cells there is dynein. So whatever cell that has dynein, it can move. So cilia in the nose, cilia in the pubes, and the flagell in the sperm. These cells have dynein inside. Dynein is a cell element. This is really well explained in biochemistry, molecular biology. I don't want to explain everything about that, but cells has microtubules, and microtubule has dynein and kinesin, which are helping the cells to move around, right? But these cells are the important cells that even after embryonic period, after development, they are still moving, right?
Okay.
So now that we know that dynein is inside the cell and inside some of the cells that are moving, and those cells that are moving, we know that those are cilia and the sperm is still moving, right? So whenever someone has a dynein defect, it means there is no dynein. It means that the cilia and the nose cannot move. The cilia and the tube cannot move. The sperm cannot move. So what do you see now? Whenever the cilia and the nose do not move, all the foreign bodies will go inside the respiratory tract and will make upper respiratory tract infection, and then even lower respiratory tract infection, because we know that those air in the nose, that are cilia in the nose, and they are moving, their movement helps with removal of the foreign bodies, right? So when there is no dynein or dynein is defective, those cilia will not work properly, and they will not be able to remove the foreign body. So the foreign body will go to the respiratory system and will make respiratory tract infection, and these people will have recurrent respiratory tract infection, right? Because they don't have this blood defense mechanism to remove the foreign body. And those people with the dynein defect, if they are female, that cilia and the tube will not work, and they will be infertile, right? Infertile means that they cannot try conception. They will not get pregnant because of what? Because the sperm cannot move towards the ovum, because ovum and sperm meets an ampulla. So that the sperm needs to move towards ampulla, right? If the sperm flagell does not have a proper dynein, so the sperm will not be able to move. And if the tube does not have cilia, it will not be helpful for the sperm to move around, right? So for the female, lack of cilia and tube, and for the male, the sperm will not be able to move. Why? Because the flagell of the sperm has a defective dynein, and the sperm is not able to move. So now we understood that the people with dynein defect have three things. One is that their heart and embryonic period will be in the right side. The heart will not be able to move toward the left and be polarized. That's why we see dextrocardia, dextro heart. It means the heart will stay in the right side of the body, right? It will not be polarized to the left. And the second thing, we will see a recurrent respiratory infection, recurrent upper respiratory tract infection, right? And the third thing, we will see infertility. And we know the reason why infertility, why recurrent infection, and why dextrocardia. So whenever we get together all these three things, they name it as kartagener syndrome. Kartagener syndrome means that the patient has a defective dynein. What is dynein? Dynein is a cell element, and it helps with the movement of the cell. So if dynein is defective, the cells that are moving will stop moving. The cells in the cilia in the nose will not be moving, so the patient will have recurrent respiratory tract infection. In male, the sperm will not be able to move, so the male will be infertile. and also the heart will be made in right side of the body. How is it diagnosed? Whenever we see a patient with dextrocardia, for example, accidentally or maybe during investigation, we see that a patient has dextrocardia. At the same time, we check the other two elements of the syndrome, or even some people come with infertility. For example, they try conception for many years, and when they go to the doctor, for example, a male with lack of sperm flagell motility goes to the doctor due to infertility, and the doctor should do an echo or an imaging or X-ray to find out if the heart is on the left side or on the right side. If the heart is on the right side, then kartagener syndrome is diagnosed. Some people don't go because of infertility, and these people go to the doctor because of recurrent upper respiratory tract infection. They go to the doctor and say that I get sick so often and recurrently, and at this time when the doctor does an imaging or chest X-ray, they see that the heart is on the right side, so the kartagener syndrome will be diagnosed. So this is a very important syndrome. It's very well explained in the reproductive system, but still, because it is here, we need to know a little bit about it. So defect in dyning is causing kartagener syndrome. What is kartagener syndrome? Defective dynein. Well, defective dynein is causing the cells not to be able to move properly. What cells in our bodies are moving during embryonic period? Heart should move to the left side of the body, so the heart will stay in the right side. This is a dynein defect, and at the same time, even after birth, the cilia in the nose and the cilia in the tube for female and the flagell in the sperm will not be able to move, and it will make a syndrome which is called kartagener syndrome. This is very high syndrome, and I have seen lots of questions in step 1 and step 2. So we need to understand that the way to remember it, because studying is easy, but maintaining something is very difficult. So let's make it easy and simple so that we remember forever. Now we see that once we understood that the heart was a loop and it was polarized with the help of dynein, so how does these septations are made? So how those chambers are made? We said that heart was first like a loop and that was polarized. So dynein was only helping with the polarization, not with the septation. And we know that atrium has a septum inside, atria and ventricle has a septum inside, and ventricles also has a septum inside. So how those are made? For those who join my neurology lecture, I said that whenever this is ectoderm, this is endoderm, and this is mesoderm. In the middle of the mesoderm, there is a notochord and notochord falling down the ectoderm and making neural tube, right? And around the neural tube, there is neural crest, and this neural crest migrates everywhere and makes different organs. For example, neural crest makes the peripheral nervous system, the neural crest makes the enteric nervous system and the gut. And at the same time, these neural crests come to the heart and make the endocardial portion. Endocardial portion is like a marker in the heart. This is like a spot in the middle of the heart, and this spot is like a marker. This just helps the symptoms to